Select a suitable burr, for example Largo, and place a silicone stop at the depth established by the X-ray. Remove completely the gutter perker and sealer up to 3 to 4 millimeters from the root apex. Select the post to be used based on the root canal width, the radiograph information and the root canal size. Teeth with little or no coronal remaining structure need posts of greater diameter. As you can see, if the canal isn't circular, the post enters into the root canal with an excessive gap. As in this clinical case, the shape of Polygon Over Post respects the morphology of the majority of the canals of single root teeth, adapting itself to the internal anatomy of the tooth canal. Polygon Over Post with non-circular section overlapping the same tooth. The resistance section is almost double that of the previous one and is capable of bringing a much higher level of resistance to the restoration. The space between the post and dentin must be the smallest possible. Interesting to note the grip and friction between the post and the canal due to the very rough surface texture. During the root canal reaming, cleanse the canal with disinfectant solution. Apply the self-etching primer in the root canal and on the tooth external surfaces. Clean the post surface with phosphoric acid gel to remove impurities and contaminating substances. Rinse the root canal with physiological solution and dry it using paper cones and air blast. Clean the post from the etching gel. Apply the self-etching primer to the post, wait at least 60 seconds, then dry it with air blast. Apply the self-etching primer in the root canal and on the tooth external surfaces. Dry the excess of primer into the canal with an absorbent cone and air blast. Fill up the root canal with self-curing or dual-curing cement using a small auto-mixing dispenser tip. Insert completely the post into the canal with a light pressure. Light cure in case of a dual type cement.
Would you come out?
Place the composite gradually with little additions, using the emerged part of the post as a guide. Light cure the composite. Follow with the reconstruction of the core and the following light cure phases until obtaining the correct shape. Remove the exceeding part of the post by a diamond burr. Warning: do not use chisel or scissors. Post-delamination may occur.